Thousands died due to overdosing on opioids this last year, bringing health officials to call it the leading cause of death in Tennessee for 2018.
This shows Amber Worthy is live in the studio with a breakdown of some legislation that could help and why a local doctor believes it should be a top priority for lawmakers. Amber?
Yes, this doctor says he keeps 3 bottles on his desk as a trophy because one of his patients gave them to him, saying that after coming to the chiropractor, she was able to stop using a monthly dose of that medication.
If there was a car seat or if there was a recall on a car part or something of that nature that was causing 134 deaths per day, can't you imagine? It would go to the top of the legislative docket, which is exactly where Senate Bill 28 absolutely has to be.
This legislation is essentially forcing insurance companies to level your primary health care costs with alternative pain management costs.
Being able to provide some way for these individuals who may want to get the help but feel that it's hopeless because they don't have the means, the insurance, or the money, and in a lot of cases, even the support.
Dr. Josh Paxton, a chiropractor in North Georgia, says a mother of 7 was prescribed this monthly supply of medication, but after chiropractic care, she was able to stop using them.
He gave me these 3 bottles as trophies that I keep in there on my desk to remind me how important of an issue this is. This has got to stop.
Dr. Paxton is no stranger to this issue. His brother was prescribed opioids that led to a dependence on the drug until the pain was healed. Then it became an addiction. Thankfully, he did not die like the 134 people said to die per day in the U.S. because of opioids.
134 people, just like that mother, just like my brother, are dying because their brain is getting addicted to these unbelievably powerful chemicals and drugs. The brain doesn't know what to do in their absence once they're introduced.
With the cost lower, they believe there will be more options to pain management.
And at $60, $70, $80, $90, even $100 in some cases, it's just outrageous and financially unbearable for a large percentage of our population.
And Dr. Paxton says, unfortunately, you will not reach all the people before they abuse those medications, and other organizations know that far too well. The Hamilton County Coalition is hosting a training tomorrow on how to save a life using opioid reversal drugs. A big portion of that training is the education about opioid abuse. Organizers say this training is necessary for anyone who knows someone who's been prescribed any pain medication.
There's often an attitude of people have done this to themselves, and it's not really a disease as much as it is a moral failing or a weakness, and that was a difficult stigma to combat. But there are a couple of approaches that we took with this. One is that it's not just a risk to the user themselves, but also to the person who may be resuscitating the person.
And the training is being held at the Hamilton County Coalition's office on Marlin Road in Chattanooga. Reporting live in the studio, Amber Worthy, News 12 Now.